This is our news, the weekend edition. And on the broadcast tonight, the number of COVID-19 cases nears 50 as more new cases are confirmed. Plus, is the country's case fatality rate concerning to health officials? Find out what the Deputy Chief Medical Officer has to say. And later on, the Christian Council President clears the air on churches being allowed to stream services.
Our news is brought to you by Alive.
Good evening, everyone. I'm Andrew Knowles, and thanks so much for joining us. The number of confirmed COVID-19 cases now pegged at 46. This after the Ministry of Health confirming the addition of 4 new cases this afternoon. 3 of the cases are hospitalized. Case number 43 is a 25-year-old male resident of Grand Bahama who is hospitalized, as is case number 44, who is a 58-year-old male of New Providence, and case number 46, a 29-year-old female also of New Providence. Only case number 45, who is a 49-year-old female of New Providence, is at home in isolation. Now, all of the new cases have no history of travel. This now brings the total number of cases on New Providence to 38, 7 on Grand Bahama and 1 on the island of Bimini. Meantime, the death toll remains at 8. Well, with the positive cases of COVID-19 in the country now in the 40s and the death toll at 8, that puts the Bahamas' fatality ratio at 19%. That is according to a review by Johns Hopkins University. Health officials say it's alarming given that we have such a sick population. From high blood pressure to heart disease and cancers to chronic respiratory issues like asthma, the high incidences of chronic non-communicable diseases makes the COVID-19 infection more of a death threat than we may even appreciate. Deputy Chief Medical Officer Dr. DeLon Brennan put it into context this way.
If you look at our data specifically, you'll see that the majority of the patients who unfortunately died in the Bahamas had a number of chronic non-communicable diseases as well, and we had older people within that grouping that died as well.
The surge in cases has come with more calls for mass testing. Health Minister Dr. Dwayne Sands confirmed government is exploring the option. There are 10,000 rapid test kits in country, with another 1,000 from the People's Republic of China through the embassy here.
We could go about testing lots more people, right? That could happen. But what would then happen is you would run out of testing supplies. And so for people who did become symptomatic, you wouldn't have enough to be able to test those people when they do have symptoms. You wouldn't have enough to be able to test healthcare providers who you're now sending back into the front line who don't have symptoms, but they need to be able to deliver care. So those people who are most going to need the test, you're not going to be able to test them.
Brennan also explained the potential flaws of these tests.
So you're giving people a false sense of security on one end, you're causing panic on another end using a flawed test. And so we could test a whole bunch more people, find out we have, by the test, a whole bunch more positives, and then we would have a much lower rate of death or a case fatality rate, because you said, I have all these people who have tested positive, but they are well and doing okay. So I explode my numbers of cases to, let's call it 200, but I only have 5 deaths or 6 deaths at this point. So my number comes back down to 3%, much like so many other countries, but that didn't mean anything.
And while he accepts that there is some level of anxiety among people over whether they may be asymptomatic, Dr. Brennan says no matter the diagnosis, the advice is the same.
So if I tell you you are positive, I still want you to stay home and avoid going out and infecting other people. If I tell you you're negative, I want you to stay home and avoid getting in contact with other people and getting the disease. So either way, regardless of whether I tell you you're positive or negative, I'm going to tell you the exact same piece of advice at the end: stay at home.
Meantime, there have been 8 COVID-19 related deaths here in the Bahamas, but what happens to the bodies of these confirmed COVID-19 cases? Well, the Deputy Chief Medical Officer explains.
So what we have done is look at what's going on around the world for some guidance along this line. And a lot of the countries, if you look at China, who started out with this, is almost universally using cremation as a method to eliminate the possibility of it passing from one person to the other. So that is currently the advice of the health ministry, that people seriously consider using cremation.
Dr. Brennan added they also have engaged funeral home directors.
So we've also had some conversations from a policy level perspective with funeral home directors, and they're just as afraid as anyone else. And when we were dealing with Ebola, which is much more of an issue of its length of time it could last in a body, we had these same sort of conversations. So they were prepared at that time to be able to handle the issues around what would need to happen when it came to handling bodies with Ebola. We think that our conversations with them have also said, this is likely not to be as infectious, but we advise using the same precautions. And so I think they're prepared to use personal protective equipment to be able to handle those bodies, and using double bagging and things like that in order to move before there's a possibility of passing it on from the body to a live person.
Well, Minister of Health Dr. Dwayne Sands confirming that the COVID-19 facility, which was to be built at the Defense Force Coral Harbor Base, has been put on hold as his ministry is currently working on a facility that can house up to 100 patients.
We are building out some 100 rooms, and based on the rudimentary, crude numbers that we have, we think that once we complete that, at least for now, we will have adequate beds. South Beach is just going online today. The Cancer Association building in Grand Bahama is not yet finished. The Okeanos property in Grand Bahama not yet finished. And so we're building out, and then we have to assess.
Sands said his ministry has been faced with the decision of investing in infrastructure or tools needed to fight the virus, all ahead of an unpredictable hurricane season.
There are a lot of moving parts here. Do we put time and resources in building out infrastructure? Or do we get more personal protective equipment? Do we get more masks? Do we provide respite areas for staff? Do we get ventilators, and so on? All of these decisions have to be made against the backdrop of hurricane season is coming. The Rand Memorial Hospital is not finished. And so we've got multiple decisions to make, and we are going to make them, because nobody is going to say, well, how come we give you a bly because the hospital wasn't ready when the winds started blowing come July or August.
With the number of confirmed COVID-19 cases in the Bahamas continuing to rise, more and more focus has been placed on COVID-19 testing. One of the biggest questions has been who should be tested, with some calling for more widespread testing across the country. According to health officials, there are two main reasons someone would be tested for the coronavirus. They include having symptoms or exposure to an infected person. Director of Infectious Diseases at Doctors Hospital, Dr. Charlie Barnaby explains.
So if you're taking care of somebody who is known to have COVID, if you're in contact with somebody who has COVID, then call your Ministry of Health so that they can determine what your risks are, and they'll let you know if you need to be tested or not.
Earlier this week, Health Minister Dr. Dwayne Sands revealed that more than 300 COVID-19 tests have been conducted in the Bahamas. He also noted that the government is considering the introduction of rapid testing. Dr. Sands has called testing an essential tool and a critical part of the Ministry of Health's in-country strategy. Well, a man is in hospital nursing stab wounds tonight. This after he was reportedly involved in an altercation with another man. Police say the man was standing outside his home on Florida Court off East Street shortly after 11 this morning when he and another man got into an argument, which escalated, resulted in the man being stabbed. He was taken to hospital where he is listed in serious but stable condition. Police are appealing to anyone with any information that can assist to contact the Central Detective Unit at 502-9991 or 2, Crime Stoppers at 328-TIPS or the nearest police station. Well, 11 Cuban nationals were captured in waters off Anguilla Key Friday morning. They were apprehended during a joint operation by members of the Royal Bahamas Defense Force and the U.S. Coast Guard. The Defense Force says the suspected migrants were screened for COVID-19 once captured and then again examined by a team from the Ministry of Health. upon their arrival at the Defense Force Coral Harbor Base. The Cuban migrants have since been handed over to the Department of Immigration, but are expected to be quarantined before being detained in the detention center. And still ahead tonight, the Christian Council president defends those churches live streaming services during the lockdown orders. And hear from a therapist on how to keep things relaxed in the home during the lockdown. Those stories on the other side of this break. Next tonight, Christian Council President Bishop Delton Fernandez is setting the record straight amid questions surrounding churches that live streamed service from their sanctuaries in the midst of last weekend's nationwide lockdown. According to Fernandez, churches were always allowed to do so. Our Bethany McDermott reports.
So no churches were ever prohibited from streaming from their sanctuary.
Following questions over whether churches were allowed to live stream services from empty churches on Palm Sunday, Christian Council President Bishop Delton Fernandez sought to clear the air on the matter, noting that pastors and some law enforcement officials were not on the same page regarding the order. He said from the beginning of the emergency order, the council met with the Prime Minister and it was agreed that streaming teams would be allowed to gather at sanctuaries on Sundays.
We went to the 24-hour lockdown that was not conveyed to the police, that was not conveyed to all pastors. So you had some running live on ZNS, others were stopped at roadblocks. That was sought out this weekend. So Good Friday and Resurrection Sunday, 10 persons maximum social distancing taking place. Teams can go in and stream live from the sanctuary.
Fernandez stressed that while he understands the argument that the church is in the building but the people, he insisted that the church is a sacred space.
However, they're sacred spaces, and there's a sense of comfort vis-a-vis why people are broadcasting from the sanctuary. Beyond not having the equipment to broadcast from home, not having the specialty, not knowing how to do it, pastors really struggle to give good messages from places they were not comfortable in.
Fernando added that since the emergency orders, churches have seen an influx of use to their online Bible study services. Additionally, he said it is his belief that the church should be considered an essential service, especially during these times.
100% faith is essential now. I don't have to argue that. If you don't think in a pandemic, which you cannot see, and something you cannot control, you need the Lord. I know governments speak, prime ministers speak, opposition leaders speak. We want the Lord to speak. And so all of those that have their churches and their leaders, they want to hear from God and from their spiritual leaders. And so faith is very much its essential service right now.
Reporting for Our News, I'm Bethany McDermott.
All right, thanks a lot, Bethany. Well, are tensions in the household beginning to rise due to the lockdown? Well, our Giorgio Bain spoke with a local therapist who has some ideas to keep things relaxed.
With a 5-day lockdown and subsequent weekend lockdowns for the rest of the month, many persons may be thinking, how can they boost the fun level within their household? Behavioral therapist Harrison Thompson has a few ideas, but first you must understand that the persons you are now spending the entire day with may have changed a little over the years.
You know, a lot of times with work and with us being so occupied with other things, a lot of us don't really get to spend a lot of time home with our family. For those that work 9 to 5 or 8 to 4, you really don't spend time with family until you get off of work. And maybe even then there are other obligations that you find yourself involved in, like the gym, after work organizations, dealing with family, dealing with other extraneous activities. We don't really spend a lot of time with family. Now that we have a lot of time with family, a lot of us are realizing for the first time that we are the same individuals we used to be.
With most persons' regular schedule now broken, how can you incorporate your regular routine into your new norm? And how can you involve your family to make it a little more exciting?
What's most important for couples right now is you need to develop a new schedule, okay? Maybe you find joy from working out together. Maybe you find more joy by working out by yourself. You need to create a schedule that both of you can kind of understand and adhere to, so that everything doesn't become an argument, so that things are kind of known, so that they don't become hot button conversation points that can trigger anxiety, that can trigger annoyance and even anger. For example, develop your routine. What is it that you want your morning to look like? Do you want to meditate? Do you want to spend time in the Bible? Do you want to go outside for some fresh air? Figure out how you guys can balance these things.
According to Thompson, it's all about communication. He suggested creating a chart which can help divide quality time and personal time.
Develop an organizational chart so that you can know ahead of time what's for me, what's for you, and what is for us. Simply knowing where we fall can dispel and can actually decrease a lot of arguments before they even have a chance to start. So let's communicate about what it is we want to do, about what it is we feel is going to assist us. And then once we identify what that looks like, where that's going to go, be obedient to that.
Reporting for our News Weekend Edition, I'm Georgie O'Bain.
When our News the Weekend Edition comes back from the break, find out the measures one lupus patient is taking to stay safe. That story and more coming up. Welcome back to our News, the Weekend Edition. With the spread of the COVID-19 rapidly increasing, lupus patient Jonelle Hume said her family is being very cautious in order to keep her safe.
During this time, I am confined to my home. We keep the place sterner. No visitors on the inside as much as possible. I wear a face mask and gloves, and I only go outside when I have to go to dialysis. I also use Clorox wipes and hand sanitizer.
Humes has been living with lupus for 7 years now and said it was quite the journey for her. She's had to be hospitalized sometimes for months on end. Despite following strict social distancing protocols, she still has to go for treatment weekly.
I still have to do dialysis at the Kidney Center out Cable Beach 3 times a week. Usually my medications a month is $500 or more. But I'm trying to finish college. I don't work, and it's very hard on my mom and dad. They try to get at least my weekly supplies.
Hume said as the coronavirus is deadly, she encourages everyone to be cautious during this time for themselves and others. Up next, paying it forward, a Grand Bahama teacher encouraging members of the public to be good Samaritans. With lockdown conditions imposed for every weekend in the month of April, a teacher in Grand Bahama is encouraging people to be good Samaritans in their community. Thyra Johnson said after hearing that the country will be on lockdown for 5 days, she thought about her students who usually need assistance and would now be locked away with parents who may not have the means to care for them.
I decided to reach out and post something on my status stating that I would help one single mother that was not working. When I made the post, about 10 minutes, not even 10, maybe 5 minutes later, a young lady reached out to me and she said that she would like me to assist her. So I asked for her to send me a list of the items for her and her kids, and she did so.
After assisting that family, she said other mothers began to reach out as well, but so did people willing to pool resources to help those in need. The Pay It Forward initiative was thus born, and Johnson began connecting people willing to give with those who need it most. She said during this time, the government can't do it alone, and those in various communities can be their brother's keeper by picking up a few extra items at the store to give away or taking as little as $5 to pool with persons who want to give.
The people receiving the goods are very, very appreciative. Some got food, some got money. So I've also had someone reach out to me saying that they were willing to pay, help someone with bills at the end of the month. So I've gotten very, very positive feedback from people, and people are very excited to give and to help others feel better. So it's a very fulfilling experience for me.
And while the COVID-19 pandemic has caused many to be jobless, Johnson said this is not a time for despair, but the time we must lean on each other and God.
Sometimes the hardest time to pray is the time you pray the hardest, especially the people of Grand Bahama who have been hit by, we've been hit by Francis, Jane, Velma, Matthew, Dorian, and it was like hurricane after hurricane, and it's like you can't get your break, and here it is now, we are under the corona conditions. So we just need to pray, remember to keep God first, as long as there's breath in our life, that we can bounce back and we can redeem ourselves from anything.
Residents across the country are being urged to salute frontline workers by banging on drums, pots, and pans, or blowing horns tonight and tomorrow night between 8:05 and 8:07 p.m. The 2-minute musical salute is meant to show love and support for those dedicated workers, including medical professionals and law enforcement officers who dare to leave their homes each day to help fight the spread of COVID-19. And to all of them, we say thank you. Well, that's a look at stories making news this evening, but stay tuned. Our weekend weather forecast is coming right up. And that's going to do it for us on a Saturday night. I'm Andrew Knowles. For all of us here at R News, thank you for watching. Let's remember to be safe and to look out for each other. Have a good night.